Right, ladies and gentlemen, today in this presentation, we're going to talk about the morphology of invasive ductal carcinoma, now known as invasive mammary carcinoma of no special type in the postgraduate books. Upon gross examination, this tumor usually presents as a hard, irregular mass. Now, the clinical presentation is likely going to be an elderly lady with a hard mass on palpation that appears in some cases to infiltrate into surface skin. In some cases, it's giving what is classically known as the purely orange appearance. Uh, Clinical presentation, so therefore varies. But when you form a biopsy or a mammogram, it shows some peculiar findings. When it comes to gross, it's usually a hard, irregular mass. So remember that invasive cancers are usually hard in consistency, they're irregular in appearance, and they show a surrounding desmoplastic stromal reaction. We'll see a gross picture shortly. Now, upon microscopy, remember that it is divided into three grades generally, grade 1, 2, and 3. The grading depends upon three parameters. One is tubule formation, second is the mitotic activity, the number of mitoses, and third is the pleomorphism. So grade 1 cancers usually show more tubular pattern of growth. There are more tubules that are visible, plant-like structures, have small round nuclei, and they show a low proliferative rate. By low proliferative rate, we mean that the number of mitoses are less. Okay, and the degree of pleomorphism, that is the variation in nuclear size in shape, would also be less in grade 1 cancers. Now, grade 2 cancers may show some degree of tubule formation, but it is less in comparison to the grade 1 tumors. There may be some solid clusters, there may be single infiltrating cells, and the degree of nuclear pleomorphism is higher. And then mitotic figures are more in comparison to grade 1 tumors. There are details that from 1 to what is the number of mitosis at which we grade a cancer as 1, 2, or 3, and what is the degree of pleomorphism where we grade it as 1, 2, 3, but that may be beyond the scope of an undergraduate curriculum. But remember that grading depends upon three factors: tubule formation, pleomorphism, and the number of mitoses. Grade 3 cancers, they are high grade cancers, and so they show a greater degree of they're very pleomorphic cells. There are solid sheets of cells. There's many cases no tubule formation, or in many cases very less tubule formation, less than 10%. Okay, so and the nuclei are high grade. Mitosis number is high, and these tumors also show some degree of tumor necrosis as well. So this is an example of invasive cancer, invasive mammary carcinoma, or invasive ductal carcinoma. You can see this yellow area. This yellow area is the normal breast parenchyma, the fat, and this in the center is an abnormal thing. It's lesion, it's a tumor that is seen infiltrating into surrounding breast parenchyma, for example here, and for example here. This, upon gross examination, appears to be an infiltrative thing. Upon microscopy, this is a low power picture. You can see these are all tumor cells. These are all tumor cells, and they are infiltrating in the surrounding breast fat. These are the adipocytes here you see. These are the adipocytes here you see, and there are infiltrating nests of tumor cells. As we look a bit closer, you can see there is some degree of pleomorphism. some small, some large cells. They have hyperchromatic nuclei. There is high nuclear to cytoplasmic ratio. And then when we move to more high power, you can see this cell, how large it is, how different it is from the surrounding cells. You can see mitosis as well. So higher, moving on, as we move on to higher grade, there is more degree of pleomorphism, less of tubule formation, and more of mitotic activity, more of pleomorphism. So this is it for now. Please let me know if you have any questions. Thanks a lot.